Hi guys, today's our topic is cardiac action potentials. Primarily there are two types of action potentials in the heart. One is nodal tissue, nodal action potential, and one is the ventricular muscle, ventricular action potential. First we'll go. Coming to the nodal action potential, we know that SA node is the pacemaker and we are talking about the action potential of the SA node now. So if you see here, there is a phase 4, phase 0 and phase 3. If you see here, the resting membrane potential here is unstable, minus 62, minus 40. It fluctuated and we call this as pre-potential or pacemaker potential. We call this as pre-potential or pacemaker potential. And this is the phase called as phase of depolarization and is by calcium influx. And phase 3 is repolarization due to the efflux of K+. So what about the pre-potential? What is the ionic basis for that? We'll talk about that now. So coming to the pre-potential, as I said, the resting membrane potential is unstable from minus 60 to minus 40. Once it reaches the threshold, then it undergoes firing by depolarization. So the first initially is due to transient calcium channel influx. So there are two types of channels called as T calcium channels, that is constant, and long lasting calcium channels. So here for the pre-potential it is transient calcium channels which causes calcium influx. And also there are currents called as funny currents. Why they are called as funny currents? In physiology, anywhere the stimulus for opening of a channel is depolarization. The opening for any channel is depolarization, but here are the channels which are located in this phase which opens with hyperpolarization. That's why we call them as hyperpolarization activated cyclic nucleotide channels or HCN channels. Why they are called funny channels? Because hyperpolarization is making them to open, and that leads to the unstable resting membrane potential. And also one more factor, stoppage of potassium efflux. So there are three factors for pre-potential. One is sodium channel, 2 transient calcium channel, 3 K plus closure. These sodium channels are nothing but funny channels. We already mentioned the depolarization is due to long lasting calcium channels. So after the pre-potential, it continues as, when it reaches the threshold, it continues as action potential in the form of depolarization, and that is due to long lasting calcium channel opening will cause calcium influx. And repolarization is universal phenomenon is due to K plus F. And coming to the effect of autonomic nervous system on nodal tissue action potential. So we know that sympathetic is going to increase sympathetic, increased heart rate. Similarly, increased parasympathetic tone decreases the heart rate. And we already know the resting heart rate is due to parasympathetic tone. Okay, whatever it is. Let us go with now with the diagram. You can see this black one is the normal one, and coming to the phase 4 of sympathetic discharge, with increased sympathetic discharge, you can see that the slope is increased. If the slope is increased means duration is reduced. So how the slope is increased? Either it may be due to early closure of potassium channels, or early opening of funny channels, or transient calcium channel opening. So that leads to the increased slope of phase 4. And if you see this, slope has decreased in vagal stimulation, that is parasympathetic stimulation. So the duration, if you see, the duration is prolonged, and that leads to decreased heart rate. So sympathetic, increasing the slope of prepotential, parasympathetic, decreasing the slope of prepotential. Coming to the ventricular action potential. Here is the ventricular action potential. It is the action potential with plateau. So what is this plateau? We'll see. Now coming to the phase 0. Phase 0 is nothing but the depolarization and is first, so we call that as early depolarization. As usually, it is due to sodium channel influx of sodium. Phase 1 is due to the universal repolarization K plus efflux, and that is early repolarization. Then phase 2 is due to calcium channels, which are long lasting, calcium channel opening, and we call that as calcium currents. And then there will be a balance between calcium influx and potassium efflux. That's why the potential remains a plateau. Then the phase 3, again the second repolarization, we call that as late repolarization. We know universally it is due to K plus efflux. And phase 4, coming back to the resting membrane potential with the help of sodium potassium pump. And what are the advantages of this plateau phase? You can see that more the plateau phase, the time duration for action potential is more. So long will be the repolarization, and that causes more refractory period. So more refractory period means the muscle doesn't undergo tetanization and also difficulty for the fatigue. And coming to the conducting system of the heart, we know that SA node is the pacemaker. So SA node followed by internodal bundles, then AV node, then bundle of His, which is dividing into the Purkinje fibers. And coming to the AV node, there is a physiological delay of 0.1 seconds. Why AV node has having a delay? Because the conduction in that is very low, 0.04 meters per second. The reason is less gap junctions, and the delay is meant there purposefully. So the atria and ventricles should not beat at a time. So atria beats 0.1 second earlier than ventricles, so that the amount of blood can be emptied into the ventricles. And the Purkinje fibers has the highest conduction velocity of 4 meters per second. We should know some terms here. Chronotropy. So anything that is concerned with the heart rate. Positive chronotropic effect, negative chronotropic effect, increasing the heart rate and decreasing the heart rate. Similarly, dromotropy is concerned with conduction. So the more the conduction, it will be the positive dromotropic effect. Less the conduction or less the more the time for conduction, we'll call that as negative dromotropy. And inotropy is concerned with contractility. We say that positive inotropes, which increase the force of contraction. Similarly, bathmotropy is concerned with excitability. All these are positively excited with sympathetic nervous system. Thank you.